Amyloid beta deposition remotely determines glucose hypometabolism within the default mode network. We found that amyloid beta aggregation in the precuneus correlates with hypometabolism in the posterior cingulate, inferior parietal, and lateral temporal cortices, but not within the precuneus. We also found that amyloid beta aggregation in the posterior cingulate remotely correlates with hypometabolism in the precuneus, inferior parietal, and lateral temporal cortices, but not within the posterior cingulate. Amyloid beta aggregation in the lateral temporal cortex remotely correlates with hypometabolism in the posterior cingulate, precuneus, and inferior parietal cortices, but not within the lateral temporal cortex. Amyloid beta aggregation in the inferior parietal cortex remotely correlates with hypometabolism in the posterior cingulate, precuneus, and lateral temporal cortices. In addition, amyloid beta aggregation in the medial prefrontal cortex remotely correlates with hypometabolism in the posterior cingulate, precuneus, inferior parietal, and lateral temporal cortices, but not within the medial prefrontal cortex. Taking these observations together, one can conclude that within the default mode network, amyloid beta aggregation associates with hypometabolism with distant rather than the same network node. Synergistic interaction between local levels of amyloid beta aggregation and metabolic dysfunction within the posterior default mode network drives cognitive decline. The animation, where each parallel line represents a single MCI subject, shows that the effects of amyloid beta on the slope of change in cognition progressively increases with a decrease of FDG uptake levels inside the posterior default mode network hubs. It is important to mention that high amyloid beta load or low levels of glucose metabolism at the hubs as a single biomarker abnormality did not determine significant cognitive deterioration over time in this population. Based on these observations, one may conclude that local amyloid beta aggregations synergistically interact with the metabolic vulnerability of the default mode network at the hub to determine subsequent clinical progression to Alzheimer's disease dementia.